back to DXB today. It's our breast cancer awareness special. It is, of course, October, breast cancer awareness throughout the entirety of this month. All sorts of events taking place around the city, and we'll keep you up to date with those. But now, as they say we are what we eat, as the saying goes. And to find out just how true that is, especially when faced with a cancer diagnosis, we're joined by the clinical dietitian, Marah Odeh, who joins us live here on the show. Thank you so much indeed for being with us.
Thank you for having me today.
I wonder what's your sort of take on this? Look, we all know, we've got to that point that we know nutrition is important to us from infancy all the way to old age. But when you're faced with a catastrophic diagnosis, like cancer, and again, we talked about that with the doctor just a little earlier on, just the very mention of the word, and what that does to you mentally, and as a result physically a little later on, is food the first thing we think of in terms of dealing with the diagnosis, or do we sort of ignore it a little bit?
It is often overlooked. Of course, when you first get diagnosed, you think about who's the best doctor, what's the best treatment, what do I need to do? But we have so much more research now that shows that nutrition is a really important part of the whole care plan for the patients. So we know the research shows that up to 80% of cancer patients are affected by malnutrition. And malnutrition isn't just someone that obviously looks underweight. It means anyone that loses a lot of weight, loses too much muscle mass, has an imbalance of micronutrients. So we want to minimize that risk, because women who take care of their nutrition during cancer, their response to treatment is a lot better. Even the symptoms that they feel, all the GI symptoms, the nausea, the vomiting, that's a lot less if they're looking after their nutrition. And we want to eat well for our energy, our immunity.
And I think a lot of times people think that when you say eat healthily, they think you've got to eat bowls of salad. And I don't have any problems with salad, but the issue that I face as a surgeon, and you will understand, is that they're not eating enough protein. And that's what I think they need for the energy, for their protein stores, to rebuild what we do surgically for them. Would you agree?
Yeah, I 100% agree. If we had to choose one macronutrient, especially during a disease, let alone cancer, protein is the most important. It will help your tissues repair, regenerate, especially after surgery.
Yes.
And for the muscle mass and bone health, we spoke a bit about bone health. That's also really important.
So have the salad, but also have
the protein,
also the steak.
Exactly.
The protein shake.
Marah, I wanted to ask you, I don't know if you've watched this Netflix series called Apple Cider Vinegar, which is about an Australian wellness influencer who falsely claimed to have terminal brain cancer amongst an avalanche of other diseases. And she built a whole wellness brand around holistic or alternative treatments and foods to treat cancer, as opposed to going down the science route. What is your opinion on such influencers or such people who do promote an alternative lifestyle or therapy for cancer treatment and diagnosis?
We need to look at nutrition as side by side with medications, which is why now dietitians are a core part of care teams. They work with doctors. I wouldn't recommend anyone to just go down the nutrition route without looking at medications. Both are equally just as important during treatment and for prevention. I watched that show you were talking about. I had so many opinions at the time.
Yeah, there was they documented another actual breast cancer patient who was shooting organic juices up her colon in order to I guess I don't know, treat the ailment, which I thought was so bizarre. The fact that in this day and age people would ignore science.
Yeah. But I mean, that's taking advantage of very vulnerable women, that promising them something that will work when it's not. So I really urge everyone, look at nutrition, but also medications. Go to your doctor, also go to your dietitian, so that you improve the outcome of the treatment.
And what I call it is, it's complementary. So when people say they want to do alternative treatment, I think it's not alternative, it's complementary. So the diet is complementing what the medical oncologist is giving the patient. And I think, you know, one of the things that I wanted to ask you about, because I get a lot of patients, because obviously, like you said in the beginning, they're worried about what their disease means, you know, which doctor to see, am I going to die, you know. And I think one of the things that we ask patients to do is basically just put themselves in our hands, like don't even think about it. And so I feel like they've lost their autonomy. They've lost like control of their body, of their lives. And so I get asked a lot about, you know, what can I eat or what shouldn't I eat and that sort of thing. So do you feel that is that something that for new patients who want to actually feel like they're in control?
Yeah. I always say food shouldn't cause fear or anxiety. It should give you a sense of empowerment, and you should look at it as balance. One food group isn't going to cure the cancer. It's not going to develop it. You need a balance of nutrients. And we spoke about protein, the most important one, but everything else is just as important. And you also want to enjoy food. You know, food is part of what you have at home with your family, friends, socially. So absolutely no fear.
So I've got a question for both of you, kind of. Does genetics play a part in terms of if you come from a certain background, you eat a particular type of food, and as you've had done for many years, can that play a part in terms of you having more of a risk to breast cancer?
Well, I mean, I'll answer from the medical point of view of the genetics. There are some cancers that are caused by having a genetic mutation, which is a mistake in your DNA, but it's actually less than 10% of cancers that we see. The majority of cancers just happen, and it's never ever going to be because you ate this or because you drank that. I mean, even with cancers like lung cancer, which we know is very much directly related to smoking. We all know, you know, an uncle who smoked until he was 90 years old and he never got cancer. So yes, there probably is some genetic proneness to some kind of carcinogens out there. For breast, I don't know.
I also wanted to ask you, because we have this thing called the internet today, which is so full of information, and there are so many anti-cancer diets on there. So my question to you is, how do you differentiate myths versus evidence-based programs?
So you want to look at the diet as a whole. So a lot of these anti-cancer diets, a lot of them that I've seen are things like juicing diets and detox diets. And these diets are technically healthy in their own way, as in having the juices healthy, but for your entire diet to be that, it lacks protein, it lacks the amino acids, it lacks your complex carbohydrates, so it lacks so many nutrients that your body needs.
Do you normally have low appetite during cancer?
Yes, absolutely. That's a really, really common side effect. So for these sort of patients, we recommend protein drinks, supplements to make up for the losses. But I would say speak with your doctor or dietitian first before starting anything.
Do you want to do a bit of myth busting, Marah? Let's do a bit of myth busting. I've got a couple of phrases here. Shall we start with, give us your thoughts on this one. Quick fire. Sugar feeds cancer.
No.
Absolutely
No.
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 Okay. What about strict alkaline will fight cancer?
No.
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 What about cutting out all dairy and all meat, and that's going to prevent cancer?
No.
I think we're on a road here.
I could have told you that.
Supplements are the miracle cure.
No.
Okay. There's a lot. Superfoods. Let's talk about superfoods, because the superfoods list seems to be getting longer and longer and longer. But where are we at with superfoods in fighting cancer? Pre-diagnosis and post-diagnosis.
I wish I could say yes, there is a superfood, but
There isn't.
there isn't.
Yeah. Well, one of the things I think that I think it's important for people who don't have cancer to also think about nutrition and diet is that we know that obesity is directly related to breast cancer. And we've seen studies that even losing 5 kilos will decrease your risk by 32%.
Wow.
So it is something that everybody can work on, you know, not just people who have cancer, is having a good diet, taking care of their weight, exercising, sleeping, all the things that we're meant to do to be healthy.
We have got just 1 minute left for a takeaway. Look, we've had a wide-ranging discussion. There's a lot of information for people to take in. We need a takeaway. We need a main takeaway for people to take away with them. What is the main takeaway when it comes to nutrition and breast cancer? Prevention, but also treatment.
Balance is key with everything. Nutrition plays a really big role in any disease, especially breast cancer. And protein is a most absolute non-negotiable.
Marah,
Sure.
can't thank you enough for coming on in. And Doc, final word for you. Thanks so much indeed for co-hosting. We should do it more often because we always just we only meet in October, don't we?
I know,
We should get it
I
more,
know.
we'll do it more often. But listen, again, you've been so kind with your time. You've been so kind with your knowledge. If you have to filter it down to one takeaway, what is it?
Gosh, I think being proactive about your health in general, you know, going out there and taking care of yourself. Women are busy, we have families to take care of, we have work to do, so you've got to take care of yourself, which includes your breath.
Dr. Ria, thank you so much indeed
Thank you.
for being with us. Big thanks to you
Thank
both
you.
for joining